In today's podcast, we'll be covering how to classify fractures that you see on X-rays. And quite often as a medical student, you are asked to present X-rays. It may be in an exam setting or in the clinic. So we'll be going through the vocabulary and the process of how to present an X-ray of a fracture. I also hope that you'll enjoy some of the artwork that I've created for this presentation. When presenting an X-ray of a fracture, or with any X-ray for that matter, you want to first of all mention the patient's name, the age of the patient, also when the X-ray was taken, whether it's left or right side that is being viewed, which part of the body is being viewed, and if, for example, if it's a bone, you want to mention all the bones that are visible, whether it's the distal end of the bone that's visible on the X-ray or the entire bone, etc. And the type of view, so whether it's an AP or a lateral, and you always want to mention, if it's not available at the time, that you would like to see an X-ray of the joint above and below, because remember, this is trauma we're talking about, so that is one of the things you want to mention. When describing a fracture, there is a set nomenclature or vocabulary that needs to be used in describing them. First of all, you want to mention that whether the fracture itself is intra or extra-articular, the type of fracture, i.e. what sort of fracture is it, and we will go through this in detail in the next few slides. Whether there has been any displacement, so has the fragment moved from its original site. Angulations, is the actual fragment angulating in any particular way. Whether the actual entire bone has been shortened, has it rotated, and is there any associated soft tissue swelling. So when classifying which type of fracture you see on the X-ray, we'll go through some of the examples here. So here's an example of a transverse fracture where there's a force which hits it directly and it makes a fracture in the bone. An oblique fracture, as we can see in this example here, is where the force itself is oblique, or even the fracture is oblique, and as a result you get a fracture which looks something like this. Now, oblique fracture, the thing to remember is if it's greater than 30 degrees it's considered oblique. If it's less than 30 degrees it's considered transverse. So if a break through the bone is less than 30 degrees it's transverse, greater than 30 is oblique. A segmental fracture is a fracture where you've got a piece between two bones, and here's an example of one. This can actually also be considered as a comminuted fracture, which this is an example of. A comminuted fracture is a fracture which has greater than two pieces. So this has 3, 1, 2, 3, and this example has more than 3 actually. So these are both examples of comminuted fractures, but this is particularly segmental because you can see a nice and clear segment which has been taken out from the bone. Spiral fractures are quite common. They happen as a result of rotational injuries. So maybe perhaps the patient has twisted their ankle and the force has been a spiral one, a rotational one, and has caused the patient to actually have a spiral fracture. The thing to remember is a patient can have more than one of these in the same bones. For example, they may have an oblique fracture which is comminuted. So they may have multiple pieces here, but it's oblique. Here are some more examples of fractures that you may encounter. An avulsion fracture is a fracture where an attachment of a muscle, for example, say there's a muscle attached to this part of the bone, and due to some great force, this bit of bone which is attached to the muscle breaks off, and that's called an avulsion fracture. So you'll see that the bit of bone is still remained attached to the tendon, which is attached obviously to the muscle. These tend to happen, for example, in the hands, in the feet, where there's sudden force and causes a snapping of the bone itself. An impacted fracture, as you can imagine, is forces coming together, and as a result the actual bone itself gets almost crushed. Although it's not a crush fracture is slightly different, but the actual bone itself gets impacted. You may see this, for example, in a neck of femur fracture where the piece itself gets impacted back onto the femur itself. These two fractures here, torus fracture and a green stick fracture, tend to happen in the pediatric population. A torus fracture is also called a buccal fracture, where, because of the fact that the bone has a much greater percentage of cartilage, so instead of breaking it actually buckles. Green stick fractures are also, again as we mentioned, the pediatric population. They tend to happen in long bones where one of the cortices is broken, one of the other, and you may see a bit of angulation where the force actually causes it to bend and break one side but not the other. Again, it's as a result of the cartilage composition of the bone is much greater. So once you've described the type of fracture it is, you want to mention whether the fracture is displaced. Now the displacement is always in relation to the distal fragment. So in this case, it would be this fragment that you'd be talking about. So let's just take this example. So here's an example of a transverse fracture, but also the distal fragment has displaced. Now when describing displacement, you want to say which way the displacement has taken place. Now say for argument's sake, let's make this lateral and this is the medial side. So you would say that this is displaced laterally, and also you need to mention how much of displacement is taking place. In this case, you've got 100% displacement laterally. It may be, for example, it could be 50% or 30%, but usually nice to give a fairly whole figure, as it's quite difficult to give very precise numbers. Remember, regardless of whatever fracture it is, it's always a distal fragment. I have to stress that, quite important point. It may be that the fracture you've had is actually angulating. Again, the same principle is which way is the angulation taking place. Is it medial, lateral, posterior, anterior, dorsal, volar? It all depends on which bone it is, which direction the angulation is taking place. But it's always worth describing how much angulation is taking place. So for example, if you just have this as the axis, we'd say this is something along the line of round about 40 degrees to 45 degrees of angulation in this case. Yeah, it looks about 45. If we were to make this again lateral and medial, so you'd say that this is a transverse fracture of the midshaft of the femur, and the distal fragment is angulated to 45 degrees laterally. It may be that as a result of the fracture, the overall length of the bone has shortened. So in this example, we have a transverse fracture of this particular bone. It looks like a femur, which I've drawn, and however the overall length has been shortened. A classical fracture which gives you a shortened bone is a neck of femur fracture, in which a patient would have a leg which is shortened and externally rotated. It may be that not only do you have a fracture, you may have a rotation of the distal fragment. Here's an example of where the distal fragment, although it was initially like this, I've depicted it here where it's actually rotated from here to there, in the sense that it was initially like that. I hope you get what I'm trying to show here. Having now been through the various ways of describing a fracture, we'll actually look at a real-life X-ray of a patient with a fracture, and we will present it with the technique we've just learned now. Okay, so if I were to present this X-ray, I'll give you a few seconds to have a look at it before I give the answer away. So putting it all together is, if I were to present this, this is a plain lateral radiograph of the right humerus and elbow of Mr. John Smith, a 40-year-old male, taken on the 2nd of February 2012. The most striking abnormality is a spiral fracture of the distal shaft of the humerus, which is shortened and posteriorly displaced about 50%. I would also like to view an AP view of this particular fracture, and also like to have radiographs of the entire humerus, shoulder and wrist joint. I'm unable to comment if this fracture is open or closed, which can only be done on inspection. So that's a very vital point I've mentioned there to whoever's listening, is that you cannot say if a fracture is open or closed until you assess the patient. If it's really obvious where a spike of a bone is really sticking out of a patient's arm and the soft tissue has been penetrated, you may be able to say this is an open injury. But if an injury or a fracture looks closed on X-ray, does not necessarily mean it is actually closed. What we mean by open or closed is whether there's a contact from the outside world into the bone. Okay. So I hope you found this little podcast useful. Try to put this into practice when you next go to clinic, and I'm sure you'll do very well. That's all for now, and thank you very much.